I was always curious about the brain, so I knew that I wanted to go into neurology. I specialize in pediatric neurology, particularly pediatric cerebrovascular diseases or pediatric stroke. Even though pediatric stroke is rare, it can be very devastating, and if I can bring my expertise to the table, I can really help these patients. When patients first see me, it involves a detailed discussion with the parents of the patient and the patient themselves in terms of what symptoms they're having, what is the problem that they're facing, and in an effort to try to understand the diagnosis for pediatric strokes. They can be coming with sudden onset of weakness of one side of the body, or sensory changes, severe headaches, vision changes, troubles with speech. Other neurological conditions I do see as well, and those patients can come with headaches, can come with tics, they can come with, as I mentioned, symptoms of weakness that could be other reasons outside of stroke. The first step starts with a clinical exam, a neurological exam. We need imaging, so that can involve an MRI of the brain, of the blood vessels. After all that, we discuss among what are the possible causes of the patient's symptoms and what can we do to further manage in terms of diagnostics or treatment. Sometimes they may also need a surgical procedure, which is a diagnostic angiogram, for which we do pair up with our surgical teams for those procedures. That is extremely important to me, to build that relationship with the child as well as their parents. I believe parents are the best people to tell us what exactly, because they know their child the best. I'm going to do everything I can to help their child, to make sure that we're addressing their symptoms, helping them with finding a diagnosis and treating them in the best way possible. It's almost like family when I see them over an extended period of time, because most of my patients I do follow over the course, some months, some years. I think the most rewarding aspect is when the child is feeling better. I can see that relief on their face. I feel like I did my job.